A very good afternoon and welcome to the session on the topic menstrual cycle and related issues. We are glad to have Dr. Aparna Jha among us today to help us understand the topic. The doctor will take us through that more in details in the session today. Be there till the end of the session. And if you have any doubts, any queries, post it on the comment section. The doctor will be answering all your questions and solving all your doubts by the end of the session. So stay tuned. Doctor, you have the stage.
Good afternoon, everyone. I am Dr. Aparna Jha, working as a senior gynecologist in Apollo Cradle, Brookfield, the one which is at Bangalore. Today, I'm here to talk to you all about a very common topic that's called menstrual cycle and irregularities with it. I'm sure 100% of the females, 100% of them would have had experience of some or the other menstrual irregularity or menstrual cycle irregularity, or could be the pain or one or the other thing. 100% of us. In fact, if there is no exaggeration, almost 30 to 35% of the population who comes to the gynec OPD has similar kind of complaint. It could be a heavier bleeding, it could be a lower bleeding, it could be a sparse bleeding, it could be a very polymenorrhea or very frequent cycles whatsoever, XYZ. But then ultimately it is related to the menstrual issue. Now, let me first come to this, that what is normal regular menstrual cycle. So every month or periodically, I may be wrong in saying every month, but then periodically, a female sheds out the endometrial tissue, the tissue which is inside the innermost layer of the uterus. That's called endometrium. It's a live tissue. It keeps growing every month, attains a thickness of 11, 12, or 13 or above 10 and then the female sheds it out. While she is shedding it out, she also sheds out those. I mean, because the live tissue are getting shed out, blood comes out with it, and this is what is called as menstrual cycle. Now, naturally, the things have are there in the body that way, that it's a cyclical thing. So the endometrial tissue builds up, goes to 10 to 11 sheds, goes to 2 or 3 and again the whole month she keeps building them up, and then again she bleeds. So now this is what is menstrual cycle. How regular it should be, how much we should be shedding out, what is all these, I'm going to explain to you further. So any cycle which is in between 28, if we say 28 plus or minus 7 days, that is 21 days to 35 days of uh, gap between each cycle. So if you have 21 days cycle, that's also fine. If you have 28 days cycle, that's also fine. If you have 32 days cycle, that is also fine. If you have 35 days cycle, that's also fine. So it's not confined to 1 month, and that is why I told you earlier that it will be wrong to say it is a monthly cycle. It may not be monthly, okay, but yes, the gap should be more or less maintained. That's one thing. Another thing is that how much is the blood loss. So the blood loss of around 45 plus or minus 15 ml, that is from 30 ml to 60 ml, is considered normal. Some female may have very scanty bleeding in the beginning and maybe 1 or 2 days proper bleeding. Some female may have uh, uh, throughout a little heavier bleeding. So it is 30 to 60 ml of blood loss is considered normal. How many days? Again, 5 plus minus 2 days, that is 3 days. to 7 days is considered normal. First 2 days, 1 or 2 days having a bit of extra heavy bleeding, and then coming back to the normal or stopping within a day or two for spotting, that's considered normal. So, all these, whatever I told, these are considered as normal menstrual cycle, plus or minus pain. That's called dysmenorrhea. The painful cycle is called as dysmenorrhea pain. Okay. Now there are some females who have extreme of pain. There are some who have no pain. So unless proved otherwise, means if I have been able to prove a reason for dysmenorrhea for a pain, it is considered normal. So if there is no reason for the pain, it is considered normal. Painful cycles are considered normal cycles. So this is what is called as normal menstrual cycle. Now coming to this, that what all could be the irregularity. So first of all, a female generally attains by, earlier we used to say 13 to 12 to 13 years, 14 years, the menarche or the first cycle. Nowadays we say from 9, 10 years till 14 years, she can attain the menarche anytime. Now coming to this, that when the menarche starts, age 46, now it is almost 53, 55. In India also it is now rejuvenated as 30, 40, 53 to 55 years. So in this time period, whatever, whenever she is having her menstrual cycle, there could be some irregularity in these menstrual cycle. I am going to talk to you in next half an hour of time about what irregularity could be there, where we should be worried, how much we should be worried, when we should be seeing a gynecologist, and when there is a treatment needed, and if there is a treatment needed, what all other options do we have available. So now coming to the beginning phase, that is puberty, that is when she has been a girl, a young girl, has attained her menarche, attained her first periods. We do see many young mothers coming back to us with in a panic state, saying that the periods are not regular. Now, let me tell you one thing: the first 2 or 3 years of periods, first 2 or 3 years, not first 2 or 3 cycles, first 2 or 3 years could be irregular. The reason is this, that in a regular language or in a non-medical language, I would say, is that the cycles, that the periods, menstrual cycle, are still in the practice phase, still has not become expert. So still there is no ovulation. The egg formation is not happening. When the egg formation starts happening, which typically starts happening after 1 or 2 years of normal regular menarche, like when the girl has attained her periods, from there after 1 or 2 years the egg starts getting formed every month. When the egg starts getting formed, then the cycles become much more defined, they become much more regular. After 14 days of the menarche, or of the ovulation, she would start having her periods. So that's when it is much more regular. Now, if at all in the first 2 years, 1 year, if at all the periods are irregular, they could be very much irregular. The girl may bleed for like 10, 12, 14 days, and then she may not bleed for 2 months, 3 months, 4 months. Again, she may bleed for a couple of weeks, and again she may not bleed, or she may have every 15 days a little bit of bleeding. Any kind of irregularity in this time frame is considered normal until proved otherwise. Means we have to investigate to these girls. We have to see if they have got any kind of hormonal imbalance, or we have to see if they're putting on a lot of weight, or we have to see if because of the period she's losing out some blood, or if we have to see that if there is a family history of any kind of hemoglobinopathies or any kind of coagulopathies, that is bleeding disorders in the family, if there is some genetic disorder. We also check upon the family history of like mother, how irregular were her periods during her younger age, how irregular was sister's periods during her younger age. So all these put together, we come to a conclusion whether this girl needs treatment or not. But at the front, at the first phase, the mother should not be panicked. If the girl has missed out on her periods for a couple of months, the mother should not be panicked. She should definitely go to the gynecologist to check upon why there is a irregularity. And after doing all the investigations, if it has come to a conclusion that yes, there is no no obvious reason, then probably it is only the anovulatory cycle because of which her periods are becoming irregular. Now, this was about the menarche. Now, we assume that in 2 to 3 years of the age of after menarche, she would start having her regular periods. Okay, uh, if there is an irregularity, there are certain words given to it, like what we call it as first word, what we call it as menorrhagia. Menorrhagia means the periods are regular. I mean, the interval is regular, but the bleeding is a little. I mean, the bleeding is prolonged, like it is more than 5 days, more than 7 days, more than 8 days, more than 10 days. But the bleeding amount is almost okay. It could be sometimes a little more, or I mean, it could be a little more and it could be a little prolonged. So that's called as menorrhagia. Metrorrhagia is something wherein the periods are excessive also and they are irregular also. The same way, there is something called hypomenorrhea or oligomenorrhea. Either the periods timing are less or the periods bleeding is less. So all these are considered as the menstrual irregularity. Sometimes what we see is that the female is having regular menstrual cycle, but in between her cycle she's also having some amount of spotting, which is called as intermenstrual spotting. It could be related to coitus, it could be related to sexual contact, that is, if at all there's a sexual contact and after that we see a bleeding, we call it as coital post-coital bleeding, or it could be just an intermenstrual bleeding, intermenstrual spotting. There are times when we also see a female very typically having a regular cycle, but 2 or 3 days prior to her cycle she would have spotting, and then after that her normal regular periods, and then the periods stop. Or sometimes she has a spotting premenstrual, she has bleeding again, and then she has postmenstrual spotting. So all these, any kind of variation from that first definition of menstrual cycle is called as irregularity of the periods, irregularity of the cycle. Now, do we have to be worried about it? At the reproductive age group, I mean, once a female has gone through those 3 or 4 years of after menarche, 3 4 years, and after that also has some irregularity, definitely that should be looked upon. We need to check for it. Now, what all are the common causes because of which there is this irregularity on the periods? Uh, Most of the time nowadays, earlier we used to have this lifestyle disorder as one of the fourth or fifth cause, but now we have lifestyle disorder is considered as one of the first major cause of menstrual irregularity. What do we mean by these lifestyle disorders or lifestyle changes? Lifestyle disorders or lifestyle changes, like, sedentary lifestyle. There is the exercises or the physical activities have become quite less. The eating habits have changed. The sleeping habits have changed. The sleep cycles have changed, and the eating, the quality and the quantity of the food has all over changed. There is a lot of there's a lot of smoking, drinking, all these things coming into the society. So all these put together, they are called lifestyles disorder or lifestyle changes, which have given rise to a lot of menstrual irregularity. All these, whatever I have talked to you about, like excessive of stress, sedentary lifestyle, junk food eating, late night, late night late working hours, morning you get up a little late. All these put together, they cause some amount of hormonal changes. They typically cause luteinizing hormone to be going up, follicular stimulating hormone FSH to be going down, and because of this, the hormones do change, and the male hormone or the progesterone hormone all these put together have been the first reason of menstrual irregularity. The second reason is hormonal imbalance. Again, if we can hold our nose directly, or we can hold our nose by moving our fingers from this side to that side. So it's the same thing. Your lifestyle disorder gives rise to hormonal imbalance. Your hormonal imbalance gives rise to your, I mean, that becomes a vicious kind of cycle. So even hormonal imbalance is very much related to the lifestyle disorder. Now, or it could be sometimes the hormonal imbalance could be a genetic thing also, like in some cases of polycystic ovary, PCOD, hyperprolactinemia, hypothyroidism. In all these situations, it could be a little bit of genetic situation also. The third and the very most common reason has become polycystic ovarian disease, or PCOD, or PCOS, wherein we see the female putting on a lot of weight, she having excessive hair growth on her body, or like male pattern hair growth on her body, and she starts having periods irregular. It could be, most of the time it could be a oligomenorrhea or hypomenorrhea, that is, she would bleed less, or she would bleed sparse, she would have, like, she would miss out on her periods. But sometimes we may also see a metromenorrhagia or a menorrhagia, that is basically her bleeding would be more, or there would be a breakthrough bleed, she would not have a cyclical bleeding. All these happens in PCOD cases also. Typically in PCOD also, these changes happen. The LH hormone starts going up, the testosterone hormone starts going up, the follicle stimulating hormone, that is FSH, that starts dropping down, the prolactin starts going up. So all these give rise to these kind of menstrual irregularity. Thyroid disorder also has become one of the common reasons for menstrual irregularity. uh, Again, the thyroid disorder has to do a lot with the lifestyle. So if there is a sedentary lifestyle, if exercise lack is there, if the female is putting on a lot of weight, she is, I mean, she has more risk of developing hypothyroidism. That is, her TSH level would start going up. Her free T3 and T4, that is her actual hormone, actual thyroid hormone, would start dropping down. Her prolactin level may start going up. So all these may give rise to those menstrual irregularity. So this is one section. This is one reason, which is typically called as hormonal disorder or lifestyle start disorder. There are some times when we see that the periods are regular, and in between there is this intermenstrual spotting, or there is this postcoital bleeding. Generally we do suspect there is something called endometrial polyp or cervical polyp. So we do get some scans done, or we do some physical examination to figure out if there is a polyp. That is another reason, which is a common reason. The third and the very common reason is uterine fibroids. Huge, big, large fibroids. Fibroids are basically tumor which are non-cancerous, benign tumor of the uterus. They are many of the times asymptomatic. So we do not know that there is a fibroid developing or existing in the woman's womb or in her uterus. But when we do a scan or when we do an examination, we figure out that there could be a fibroid, which could be the reason of her periods not being so regular, or they being heavy, or at times scanty also, or intermenstrual spotting or intermenstrual bleeding. That is another reason. One of the rare reasons are coagulopathies or hematological disorder. These are generally genetic disorder. So there are some clotting factors. So the body's blood needs to be clotted on its own when required, when needed. There are some families wherein these coagulopathies run, wherein there's no she would not have enough amount of clotting factor. So once she starts pouring, when she starts bleeding, she doesn't stop to bleed. But generally we do figure out these disorders in a very early stage of her life, because her bleeding would be quite profuse bleeding. And when we do take some history, or when we do some certain examinations, or certain when we run certain tests onto her, we realize that there is a coagulopathy. The another the rarest one of the rarest cause could be cancer, like cancer of endometrium, that is, inside the uterus there is a cancer of the mouth of the uterus, which is called a cervical cancer. Very rarely rare, ovarian cancer generally does not cause bleeding disorder or menstrual irregularity, but yes, that could be another reason. The another important reason could be at times some amount of use of other drugs like antipsychotic drugs, antidepressant, anticoagulants like warfarin, acetram. All these can give rise to menstrual irregularities. Now, these all are the reasons. What do we what as a patient, should you expect when you go to your doctor or when you reach your gynecologist out? So we generally take a detailed physical exam. We generally take a detailed history of the patient to get to know, because 50% of the time or 70% of the time we're able to diagnose something, we're able to at least come to a differential diagnosis by doing a detailed history taking and a physical examination. So by couple of examinations, by couple of history, we are able to figure out whether we should put it into a menstrual irregularity or because of hormonal disorder, or menstrual irregularity because of polyp, or menstrual irregularity because of any anatomical disorder like a fibroid or so, or could it be a coagulopathy, or could it be a cancer. So after that we run certain tests like certain blood tests, some ultrasound examination, or detailed physical examination, and by that we come to almost 99% of the time, 98% of the time, we are able to figure out a diagnosis. And once the diagnosis has been arrived, after that, the treatment of menstrual irregularity is completely dependent on patient. It is not that each treatment is one of the same for everybody. It is catered according to the need of the patient, according to her age, according to her need, according to we look at every aspect of the patient and then start the treatment plan. If there is a menstrual irregularity at a very young age, like a girl of 13 or 14, sometimes we give no treatment. We just put a reassurance to the patient or mother saying that it is fine, let her do some exercises and she'll be all fine. Sometimes, if there is a heavy bleeding at that young age, we start giving immediately some hormonal pills, some treatment plan to make sure that she doesn't lose out her blood too much. Coming to reproductive age group, a young female who's now, again, we need to look upon whether she's married or not, whether she requires pregnancy or not, when she's planning for her pregnancy, and accordingly we again differentiate them according to their need. Sometimes we give them hormonal pills, sometimes we do not give them hormonal pill. Sometimes we offer them other different treatment plan like a Mirena or like a DNC or a cleaning process. That is all dependent on which age group she belongs to, what exactly is her need. If her only need is to regulate her menstrual cycle, then typically we give those contraceptive pills for a couple of months, and then we tend to tell her to come back, revert back to us to look at the progress. If the same menstrual irregularity has happened after the age of 45, 48, as in when she has already completed her family, that is when we need to definitely figure out or rule out, rather than, so this is the age group where we do not worry too much about the hormonal imbalance. We rather worry a little more about those rare disorders like carcinomas, cancers, endometrial cancer, uterine cancer, or the cervical cancer, or rarely rare ovarian cancer. So that's when we go a little more into the investigation part. We try to also sometimes do some invasive investigations, or like endometrial pimpling, like a diagnostic dilatation curettage, like a hysteroscopy, and we try to figure out a reason for it. If there is a certain reason, if the reason is conclusive, then we treat it. If the reason is inconclusive, and if the reason is inconclusive, we wait further to see how she's progressing with the medications and all. And if the progress is not that great, then we at times, in severe condition or in extreme condition, we also attempt to take out the uterus, which is called as hysterectomy. The need of hysterectomy is rare for abnormal uterine bleeding, but yeah, it happens. It's not that it doesn't happen, it does happen. And then if there is a need of that, we knock out the organ. So this is how we treat, or this is how we investigate abnormal uterine bleeding, or we menstrual irregularities. So, with this, I would conclude saying this, that all the menstrual irregularities need, first of all, we need to know whether this is an irregularity or not. If we know that there's an irregularity, depending upon the patient's age, her need of having pregnancy, her need of bearing a child, and her genetic requirement, with all that we cater, we plan for each patient a different treatment plan, and we stick to it. With this, I would conclude my topic. If there are questions, I am happy to take them on. Thank you, everybody, for your patient listening. Hope you have a good day.